Hello guys, do you know that by following a healthy diet and lifestyle, you can prevent or improve high blood pressure and in some cases lower your medication? So now I start with potassium. A high potassium diet is associated with a lower risk of hypertension, stroke and renal disease. Fruits and vegetables with high amount of potassium including bananas, oranges, cantaloupes, honeydew, apricots, cooked spinach, cooked broccoli, and grapefruit. Some dried fruits such as prawns, raisins, and dates are also high in potassium. Reducing salt intake often when people with high blood pressure cut back on salt, their blood pressure falls. Reducing salt also prevents blood pressure from rising, and dietary guidelines for Americans recommend that Americans should consume less than 2.3 grams of sodium per day. Other thing is the consumption of more than 2 alcoholic drinks or more than 30 milliliters of alcohol per day, which is associated with higher blood pressure and hypertension. A high ratio of dietary polyunsaturated to saturated fat in the presence of low total fat consumption result in a modest reduction in blood pressure. Blood pressure is lower in vegetarian population compared to people with a normal diet, and result of some studies indicated that higher fiber consumption is associated with a lower rate of high blood pressure. There have been some studies to suggest garlic lowers blood pressure in addition to improve cholesterol and reducing some cancers. Magnesium plays an important role in many body organs such as the heart, bones, muscles, nerves, and other organs. Without enough magnesium, this area cannot work properly. A diet low in magnesium raises your blood pressure. Magnesium is found in whole grains, green leafy vegetables, nuts, seeds, and dry peas and beans. The recommended daily allowance for adults more than 19 years old is about 400 milligrams daily for men and 300 milligrams for women. I will explain more about magnesium in my future videos. Calcium is other important nutrient. Population with lower calcium intake have higher rate of high blood pressure. However, it has not been proven that taking calcium tablet will prevent with high blood pressure. But it is important to get at least the recommended amount of calcium, which is 1000 milligrams per day for adults between 19 and 15 years old and 1200 milligrams for those over 50 and lactating women. Other thing is fish oil, which may help reducing high blood pressure. And people who are physically active have a 20 to 50% lower risk of hypertension compared to people with a sedentary lifestyle. Endurance training reduces blood pressure more in person with hypertension compared to individuals with normal blood pressure. A review of some clinical studies in individuals with hypertension show that regular medium intensity to high intensity aerobic activity lowers blood pressure by about 11 millimeter in systolic and 5 millimeter in diastolic. Blood pressure can be controlled by reducing weight. In a recent meta-analysis study, any reduction in body weight lowers blood pressure by an average 3 millimeter and diastolic blood pressure by on average 2 millimeter. And finally, the last one is the DASH diet, which is very helpful for maintaining a healthy blood pressure. In my upcoming video, I will explain how to maintain healthy blood pressure with a DASH diet. Okay guys, we enter the end of the discussion about hypertension. If you have any question, leave a comment below. Make sure to like and subscribe, and you could be able to watch my future videos. Thank you for watching and being careful about your health.